Coronavirus cases surging in Texas, hospitalizations there breaking records 2 weeks in a row. At this rate, hospitals in Houston could run out of ICU beds in just another 2 weeks. NBC News reporter Priscilla Thompson joins us now from Houston. And Priscilla, what are health officials and doctors in Houston saying about what's going on? Do they have a plan if the hospitals there do run out of ICU beds in a couple of weeks?
Well, Allison, all of these hospitals have surge plans, and many of them that are already nearing or at capacity are starting to implement those. And, you know, the city, for their part, has been working with the hospitals to try to spread out these patients that are in the intensive care units in order to help sort of the hospitals share the load. We now know that Texas Children's Hospital is actually going to be accepting adult COVID patients. They have a special isolation unit where they're going to be putting those folks and working to treat them there as well. And, you know, I spoke to doctors here who told me that, you know, at some point, of course, a lot of people do not want the economy to have to shut back down, for things to have to close back down. But at this rate, that may no longer be up to people. It may be up to the virus. Take a listen to what folks told me.
If we project out a few weeks, we will have a big problem, and the virus will take control of our society. And shut down, whether that's a government election or not, will become moot, because it'll just happen to us if we don't work together right now.
And if things get to that point, obviously, the county could stand up another field hospital. They did that early on in the pandemic and then took it down without ever having to use it. But it can accommodate around 150 patients, although officials here tell us that those beds would likely go very quickly if this virus continues at the rate that it is now, Allison.
Priscilla, let's talk about Texas as a whole. Outside of Houston, what other parts of the state are seeing a lot of cases and also increased hospitalizations?
Well, a lot of the big cities, you know, yes, there's Houston, but there's also Dallas, San Antonio, Austin. All of those areas are also seeing a lot of these similar issues. And one thing that has happened recently in the past several days is that a number of these counties and cities have implemented new mask orders. So while the governor has signaled that officials cannot force individuals to wear masks, they can ask businesses to ask individuals to wear masks. And so we see those orders going to effect, and we'll likely begin to see the results of those in anywhere from 2 to 3 weeks. But a number of local officials have expressed some frustration with the governor that he didn't clarify and make that point more clear early on, because for a while, local officials were asking the governor for the power to require individuals to wear masks, and now they have that clarification that they can ask the businesses to do that. But precious time possibly wasted as we see those numbers continue to tick up.
Yeah, Priscilla, let's talk about the governor changing his guidance, now recommending that people in Texas stay home. Here he is.
Because the spread is so rampant right now, there's never a reason for you to have to leave your home unless you do need to go out. The safest place for you is at your home.
Priscilla, is the governor considering new stay-at-home orders or other strict measures if things there don't improve?
It's a great question, Allison. Well, certainly a lot more urgency from the governor this week than last week. Last week, he said there was still an abundance of hospital beds available. And obviously this week, taking that tone of encouraging people to really stay home. He has said that a statewide stay-at-home order would be an absolutely last resort. He doesn't want to have to do that. But we have seen him in the past couple of days implementing new executive orders. One is going to be on large outdoor gatherings. Previously, he was only going to allow officials to put restrictions on gatherings of 500 people or more. He has now reduced those additional restrictions to gatherings of 100 people or more. And he's also re-implementing some of the restrictions that were placed on child care facilities early on, because he says that the large gathering and the child care facilities are two areas where he's seeing a lot of these cases stem from, Allison.
All right, Priscilla Thompson in Houston, thanks so much.
Thanks, Allison.
The U.S. just recorded its highest number of new coronavirus cases in 2 months, more than 35,000 new infections nationwide yesterday. We haven't seen a number like that since late April. Dr. Amesh Adalja joins me now. He's an infectious disease doctor and a senior scholar at Johns Hopkins University. Dr. Adalja, what do you make of those numbers, and how concerned are you about where we're heading as a country?
I think what we're seeing is a very heterogeneous outbreak where some states are really looking like they're losing control of this outbreak. And I look at the states that have a % positive of tests rising, places like Arizona, places like Texas, and places like Florida, where we're seeing cases go up as well as the % of tests going up. And they're impinging on hospitals. We're hearing about Texas hospitals being stressed, and Arizona hospitals being stressed. And I think that is very worrisome. We need to make sure that we can control the number of cases that we're getting by having robust contact tracing. And I think this underscores the need that when you open a state up, when people start interacting, you have to have the resources in place to be able to prevent chains of transmission from beginning.
States like Texas, we just talked about, reporting a record number of new cases. The governor there now urging people to stay home. Is it too late for that? And if so, or even if not, how can states most effectively fight spikes like this while they are in the process of reopening?
So it isn't too late. We do need people to start acting as if we're in the middle of a pandemic. People are going to have to take risks every time they step out the door. And I think it's important when you're in a place where the number of cases is increasing and we're hearing about hospitals being stressed, like, for example, in Houston, that people be very mindful about their contacts and try to avoid any kind of condition that might spread this virus. So that's going to take some time for that to show an impact, but that's one thing that needs to be done. The other thing that needs to be done is hospitals need to be adequately resourced, make sure they have enough personal protective equipment and ICU beds, and we need to get contact tracing to a level that can deal with these cases. I think the reason why these cases start to spiral out of control is because we can't keep up with the contact tracing. If we can contact trace every case, then I do think we can handle this in a more responsible manner. And I think that's going to be the challenge as we move forward in this pandemic, making sure that we can deal with the number of cases that we're inevitably going to get as people socially interact.
Dr. Adalja, studies suggest nearly 9 million Americans came down with the coronavirus in March, but more than 80% of them were never diagnosed. That study was based off of CDC data for flu-like illnesses. What does that tell you about the outbreak here in the U.S.? What do those findings mean?
What it means is that we really were not looking for the cases in the way that we should have been. We knew that this virus had been spreading in China since at least November, that there were cases that were diagnosed at Christmas time in France, and also now we're hearing about Italy having cases in their sewage. So this is something that had definitely spread, and we knew in the beginning that our testing policies were missing most of the cases because we were only testing people that came back from China, and we were only testing people with lower respiratory tract symptoms, not milder cases. So we knew that we were missing these cases, and those cases were going on to then transmit and start chains of transmission that ended up getting us to the situation we got to in March. And this is more evidence of the fact that early testing in January and February, having the right testing protocol, would have forestalled some of the complications we saw with needing all of these economic shutdowns that occurred all over the country that didn't need to happen.
All right, lastly, let's talk about masks. They continue to be a contentious, even political issue. Could you please explain from a medical perspective the difference that wearing a mask can make in stopping the spread of the coronavirus?
So if you are somebody that is sick with this virus, even if you have mild symptoms, the droplets that come out of your mouth when you talk and when you do any kind of activity, those can transmit the virus. So wearing a mask, especially if you're somebody that harbors this virus, can prevent you from spreading it to others. And I think it's not just masks, it's actually face shields are also something that's coming into a little bit of vogue now because people are realizing that those might actually have more data supporting their use. So we may see face coverings of all sorts, including face shields, become part of the norm. And it's one way to decrease transmission from those individuals who harbor the virus and are out in public within 6 feet of other people.
Dr. Adalja, before we let you go, can I ask you a little bit more about that with masks? Just the other day, my husband said to me, well, what's better? I mean, is it okay to wear a bandana? I have a mask. Should I wear something more covering? Are there sort of degrees of what is most effective as a face covering?
So it's important to remember that we don't have a lot of great evidence on homemade masks, and people that wear those homemade masks tend to touch their face a lot. So we don't really know exactly what the impact of them are. So I'm somebody that thinks that face shields are probably the better way to go about this because you don't touch your face. They're easier to wear, and they may be the covering of the future.
All right, Dr. Adalja, always great to see you. Thank you for coming back and talking with us today.
Thank you.
The Trump administration scaling back its support for COVID-19 testing sites, even though top health officials are warning about the disturbing surge of coronavirus cases in the U.S. NBCNews.com senior White House correspondent Shannon Pettypiece joins me now. And Shannon, what do you know about this move by the administration?
So what we're talking about here, Allison, are 13 of these federally funded testing centers. The administration had planned to stop funding for them back in April and then gave them a one-time extension. Now, HHS tells us that there has been widespread expansion in testing since these were put into place, and that they're shifting their focus to doing testing at retail sites. They had about 600 retail and pharmacy sites where testing is available, and these federally qualified health centers out there. There's about 1,300 of those. So they're trying to downplay the significance of cutting back on these testing centers. But of course, as you noted, the president has recently raised questions about testing, saying that it makes the United States look bad the more testing we do, because the more cases it shows out there. Of course, testing doesn't create cases. The cases are out there. It only identifies them. And this move to cut these testing centers has come under a lot of criticism, particularly in Texas, where there are 7 of these centers. And of course, I know you've been talking about Houston, one area that's being particularly hard hit, has several of these centers that do a few hundred tests a day. And even Senator Ted Cruz has been urging the White House to keep funding for these centers going, especially in the middle of these surging cases that we're seeing in Texas.
Shannon, the president and Dr. Fauci aren't always exactly on the same page, but this really looks like the president is kind of flat out ignoring what Fauci and his top health officials are advising. What's going on here?
Well, for a number of days now, the president has been trying to downplay the increase in cases that we're seeing in so many states. Yesterday, when he was giving a speech, he essentially talked about the worst being behind us, or that hopefully we're near the end of this pandemic, as we are seeing so many places seeing record numbers. He continued to hold indoor events after his Tulsa rally. He held another event yesterday with several thousand people packed into a stadium, few of them in masks. So yes, the president is certainly modeling behavior that is exactly what his top health officials have been advising the public not to do, like having a large gathering where people aren't in masks. So yes, that disconnect continues here as we see the federal government pulling back on testing sites.
Shannon, the president hosting his first foreign leader in more than 3 months today, Polish President, I'm going to try to say this as well as I can, Andrzej Duda. He is up for re-election in just 4 days. Typically, these kinds of meetings don't happen right before an election. Can you tell us about their meeting today?
Well, typically they didn't in any other administration, but this administration has had other leaders come close to their election. Prime Minister Benjamin Netanyahu came to the White House very close to his election, and it's seen as a way to help give these leaders who the president views favorably a boost in their reelection efforts. President Trump is popular in Poland, and the United States is particularly popular in Poland. And when you can have a leader of a country show that he is close to the United States, such a powerful, influential country, that is believed to be something that can help them get reelected, and this belief that the relationship is good between Poland and the U.S. and that is a selling point for President Duda as he has this reelection. And of course, not only here during his reelection, but this is the first visit of a foreign leader since this pandemic began. And there were a number of foreign leaders who did not want to travel to the U.S. for the G7 summit specifically. So that also kind of shows how President Duda and President Trump are on the same page when it comes to how they are responding to this coronavirus pandemic.
Shannon, we know the European Union might ban Americans from traveling there because of the coronavirus. Poland is a member of the EU. Do we know if that came up at all yet today?
We do not yet. I'm certain that's going to be something that comes up in a press conference that the president is expected to have in actually a few minutes here. But yeah, as you noted, the European Union has been talking about not wanting, considering at least, not allowing American travelers to come because the country has worked very hard to get the number of cases down. And of course, the U.S. Has put restrictions on travel from certain European countries for certain travelers because the U.S. has not wanted to see Europeans bring the infection here, which is, even though they already did bring the infection here, but not wanting to see an increase of that. So a continued back and forth between the U.S. and Europe over that.
All right, Shannon Pettypiece, always great to see you. Thank you so much.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.